Welcome to your last video for our Chapter 15 video lecture series, where we're going to talk about Section 15.8 on autonomic reflexes. We'll see that our autonomic reflexes are also known as our visceral reflexes and are pre-programmed responses to a stimulus that is generated by a reflex arc. And this is similar to the reflex arc that we talked about in our peripheral nervous system lecture. We are going to see that we will have a receptor that will transmit information to a sensory neuron that travels over to our central nervous system. Our central nervous system is our integration center that'll send out information through two motor neurons. So that's the difference here. We have our preganglionic axon that travels, mostly to a ganglionic neuron, but we do have some other pathways. And then we have our ganglionic neuron or postganglionic neuron that'll continue over to our effector organ, which would be cardiac muscle, smooth muscle, or a gland. So now let's go into specific reflexes. First, we have our cardiovascular reflex to regulate our blood pressure. Our stretch receptors that we would have within our vessel walls would respond to pressure elevation, and then signals are sent to the cardiac center in our medulla oblongata, letting us know the elevation and pressure, and an inhibition of our sympathetic nerve fibers would be sent, and activation of parasympathetic nerve fibers would activate output to the heart. And that would slow our heart rate, decrease the volume of our blood ejected, which would then decrease our blood pressure. Now for our gastrointestinal reflex, also known as the defecation reflex. We have some sensory neurons that would respond to a stretch here in the rectum that would take place from fecal matter building up within the rectum. That signal is sent to our spinal cord and communicated to our motor neurons that would then stimulate the rectum to contract, and for our internal anal sphincter here, which is a involuntary circular muscle that closes up the rectum, it would cause it to relax so that the contents within the rectum could move out. Now there's another muscle that we have to control in order to do this. There's also an external anal sphincter that is made up of skeletal muscle, which means it is voluntary control, right? Under conscious control. So when you decide, yes, it is a proper moment to expel the contents in the rectum, then you cause this sphincter to relax as well, and contents will move out. Now for our micturition reflex, or the urination reflex. We will have some stretch receptors within the bladder become stimulated when our bladder fills with urine. Those signals are then sent to the sacral spinal cord, and if the person is an infant, this would result in a reflexive contraction of the smooth muscle within the bladder and relaxation of the urethral sphincters to allow the contents to empty out. But once we toilet train the toddler, the signals through the pons will allow for voluntary control of our external urethral sphincter, which would then allow the contents to be expelled. And one other thing to notice here is that the motor neuron you see in brown here is going to be a pelvic splanchnic nerve. So you could think of this as your a continuation of your preganglionic neuron, and it synapses within the wall of the urinary bladder to the postganglionic neuron in green. And the last thing we're going to talk about is this clinical view on autonomic dysreflexia. This is a condition in which you have had a spinal cord injury at or superior to the T6 vertebrae and causes a hyperactivity of your autonomic nervous system. We will see that you will get some type of strong stimulus inferior to that injury site. For instance, a distended bladder, or it can even be your bowels, that can result in an imbalanced autonomic response. And so we see that your sympathetic spinal reflex isn't counterbalanced by your parasympathetic response because all the signals being sent are blocked by this injury to the spinal cord. And so we get increases within blood pressure. And I'm going to play a short video just describing this in more detail, and that will be the end of your Chapter 15 video lecture series.
In this short video, we will show you how to recognize and understand autonomic dysreflexia. Before a spinal cord injury, your brain would get a signal from your body that it has pain or discomfort. After a spinal cord injury, this autonomic reaction may be blocked at the level of your injury, and the body can no longer send these messages to the brain. During AD, the discomfort below your injury turns on autonomic nerves that trigger your blood vessels to squeeze tight, forcing your blood pressure to rise. If your blood pressure is between 20 and 40 points higher than normal, then you may be experiencing autonomic dysreflexia. Your brain senses this and sends signals back through your body, trying to lower your blood pressure. At the same time, your brain sends a signal to your heart, telling it to slow down. Your brain will send messages to the blood vessels in your face, neck, and upper chest. This can make you look flushed or blotchy. Your brain tries to tell the blood vessels in your legs and abdomen to stop squeezing, but again, the injury has blocked those messages. So, your blood vessels keep squeezing and your blood pressure can continue to rise. If this is not stopped, it can lead to seizure, stroke, and even death. How do you know if you are experiencing autonomic dysreflexia? Some common symptoms are high blood pressure, a severe headache, sweating above the level of your spinal cord injury, blotchy skin, a slow heart rate, the feeling of worry. Often, a severe headache is a person's first sign that they have AD. Bladder problems are the #1 cause of AD, and it may be caused by something as simple as a kinked or clogged catheter tube. It may be that your urine bag is full. Ask your nurse about other things related to your bladder that could cause AD. However, if your catheter is blocked, change it immediately. Bowel issues may also cause autonomic dysreflexia. Constipation, hard stools, and impaction can all cause AD. If AD occurs during your bowel program, there are lubricants with numbing medications that may help. Talk to your doctor about this. Anything that could cause you pain or discomfort below your injury can cause autonomic dysreflexia. That includes bed sores, skin irritations, scrapes, bruises, even an ingrown toenail can cause AD. Be aware of how your clothes fit. Keep them from bunching up. Smooth out bed sheets, and keep things like your wallet, phone, or other hard objects from putting pressure on your skin. For some, sexual activity can lead to autonomic dysreflexia. Some medications, herbal remedies, and recreational drugs can also increase your risk for AD. It is important that you know what to do if you suspect you are experiencing AD. First, sit upright. Raise your head up and lower your legs. This will help lower your blood pressure. Next, loosen any clothes or items around your body that may be tight or constrictive. This includes abdominal binders, bras, belts, shoes, socks, and stockings. Finally, find the problem that's causing the issue. Start by checking your catheter. Remove any kinks, or if your bag is full, drain it. If you experience AD during a bowel program and you're using digital stimulation, stop immediately and do not resume until your blood pressure is normal. You may have to perform a rectal exam and clear any stool in the rectum. Thoroughly check your skin for any bruises, sores, or scrapes that may be causing your blood pressure to rise. Take your blood pressure. If it's 20 to 40 points higher than your normal blood pressure, you may be experiencing autonomic dysreflexia. If you're not able to find the cause of your AD, seek medical treatment. You may need to call 911 if you're not able to correct the situation and bring your blood pressure down to normal. If you seek medical help, make sure to bring your AD wallet card with you. Many physicians are not familiar with AD, and your AD wallet card will be a valuable resource. Autonomic dysreflexia is a serious condition and can be life-threatening. However, if you recognize the symptoms and take corrective steps quickly, you will likely be able to control and correct it.